Okay, very good. Okay, this is Paige. She is my new med student. So I've noticed that she has been doing some bending forward, seemed like she's trying to stretch her back out. So I thought this would be a good way to show her some manipulations because she's been seeing me do them, and that way she can kind of feel what I'm doing, and we can actually see if she has any issues. So have you been having back pain for a little bit?
Yes.
How long have you had back pain for?
Upper back is the last couple months. The
Okay.
lower back has always kind of hurt if I stand for a while.
Okay. Did you do anything to your upper back to cause pain?
No, I think my posture is just terrible.
Okay. Your shoulders are rolled a little bit forward, but it's not too bad. Okay, so when I start, I actually will start here, and with people who tell me they have upper back pain, and I will feel the first rib. And so, like, do you feel how this is more painful than this? So you have an elevated first rib right here, so we'll fix that. So then I feel the spine. So here's your spinous process. I go and kind of like it drops down. I don't know if you can feel that when I'm pushing over. And that space is called what we call like the gutter space, but basically that's where your transverse processes are. And so I'm gonna kind of walk down, and I'm not putting tons of pressure, but like, does this feel a little bit painful here?
A little bit.
Yeah. So like I can feel that it's posterior here, and that's gonna be an area of treatment, and so is here.
Yep.
So definitely some things in her upper back.
The second one you pushed is a rib that frequently pops out on me.
Okay. So just some general kind of tightness in your low back. And so when I'm checking the pelvis of someone, you've got your iliac crest here, and then I follow it around to the back. And then here's your PSIS, this little bones that kind of stick out back here. Go ahead and bend forward for me. Okay, come on up. You definitely got something on your left side. And so don't move, just kind of stay there. So the other thing I'm looking at is I'm looking at her hip height, and I can see that her hip looks a little teeny bit elevated compared to this side. Looking at her feet, seeing if anything looks rotated inward or out, and it doesn't. So go ahead and lay on your back. Just some extra things I'm looking at when I'm evaluating someone. So the hip that was the issue was here. So we're gonna bring this leg up and this leg up. And now you've seen me do this, and this is literally just what I call a shotgun approach, a quick approach to kind of reset the pelvis.
Okay.
So go ahead and push your knees in together. And then you're gonna go ahead and pull apart. And then you're gonna push them together. And then you're gonna go ahead and pull apart again. Okay, legs are gonna go down. And so I can see, looking at this, that one leg is shorter than the other, and it looks like her left leg is shorter than the other, which means this side should be superior, and it is. So we're gonna pull your leg off. And then you are gonna go ahead and push your knee up against my hand here. Good. Relax. And then I'm just kind of monitoring it. I push down a little bit here, but not too much. Go ahead and push again. And stop. Okay, and then go ahead and push again. Good. Okay. And then you're gonna stay right here so I can fix this rib real quick. So it's a lot easier to feel when someone's laying down. So like, I can locate this much better when someone's laying down. So I've got my hand on that rib. Bring me up your arm. Bring the arm up. And then I'm gonna have you take your arm. So see if you can feel this. So right there. Did you feel like that change right there? That's where it got harder underneath my hand. That's what I'm feeling for. So go ahead and push against my hand. Good. And I'm pushing that rib down at the same time. And relax. And then go ahead and push again. And stop. Go ahead and push one more time. Good. And relax. Now that's better. Do you feel that difference?
I do.
Good. All right, I'm gonna have you turn over onto your stomach. So I felt a couple different things in your upper back, and you think this one's more of a rib.
Yeah, there's a rib that slips off.
Like right in here. I'll fix that in a second. Have you had it worked on before?
Yes, I've had it. There's times where it hurts a lot. It's not like super aggravated right now, and I can like make it pop on my own.
Okay,
But
turn on this side for me. So your sacrum, that's what I call a torsion. Okay. Bring your nose forward. And then go ahead and push your feet down to the table. And stop. Push down again. and push. Good, okay. Straighten your bottom leg out for me. Here. So you lack in mobility of the spine a little bit because the goal is to be able to get this arm down to the ground with this knee down on the other side. So you're like engaging that twisting motion. So definitely work on that. Okay, go back onto your stomach. Oh, that's better. So your low back is tight, but it's not a ton of like issues I see, and it might just be coming from your hips and your sacrum. So we'll find it out. Let me find where that posterior rib was. I almost feel like it's like right here.
Yeah, it's good.
Okay.
It feels really low.
So relax your arm. So to fix that rib, what I do is I put my finger on it, on the lateral aspect of the rib, and so I'm going to push down and push lateral, and I use your arm kind of as a fulcrum, and I bring it to where I feel it get a little harder under my thumb. So you're gonna try and pull your arm down, and I'm gonna push that rib. Good. And we're gonna do that again. Good. Let's see, does that feel better? Yeah. Okay, go ahead and sit up for me. And the last thing we're gonna do is look at that thoracic segment I found. So thoracics are easier to fix sitting up. At least the upper thoracics are. Okay, so I want you to bend forward. You're gonna touch your toes. Okay, come on up. Now I want you to extend your back. Okay, good. So I am setting her up in a position of where it gets worse under my hand when I'm feeling. So I've got worse inflection, so I'm gonna flex a little bit forward. And I'm gonna turn you this way. So I want you to take your right shoulder and I want you to turn it to the left. Good, and relax. And I'm gonna bend her more forward, so bend a little bit more. And then go ahead and turn again. And stop. Bend a little bit more. One more time. Good. I'm gonna bring it back up in neutral. Feels a little bit better. Good. Stand up and see how that feels. Feels different in your back. Bend forward.
Yeah.
Feel better? Good. Awesome.